Okay, Madam Chair, we are live.
Okay. Good evening. Welcome everybody to our first meeting for the year of the Older Adult Issues, Housing, Health, and Welfare Committee. I am Ruth Greenfield Mazer, Chair of this committee, and I look forward to all of our special guests tonight who will be presenting to us. And we will begin with Amir Abadi. Thank you so much for coming this evening. And Amir is a representative of Maimonides Medical Center.
Thank you so much for having me, everyone. Hi, my name is Amir. I'm the Director of Community and Government Relations for Maimonides. I'm a bit of a new member of the team. I work very closely with Douglas Jablin. I don't know if you guys know Michael and Patrick, our community relations team over there,
Mhm.
but I'm going to be working with them supporting their government relations going forward. I look forward to working with this board very much. I have a PowerPoint slide that I'm going to share just to reintroduce, hopefully, Maimonides to the group, talk about some of the resources and services we offer, acknowledge some of the major milestones we've crossed in the recent past, and hopefully just bring the great resource around the corner more to the fold of conversation in the board. One second, let me share my screen. Okay. Can everybody see my screen? Good to go?
Perfect.
Beautiful. Okay, so let's start with Maimonides. So Maimonides is actually the name of the hospital. It is pronounced Maimonides. We are named after an 1100s rabbi from Spain. He was a world-renowned physician at the time who famously said the physician should not treat the disease, but rather the patient who is suffering from it. It's an important perspective that we want to make sure people understand. So that is Maimonides. Just if you see anybody pronounce it incorrectly, please educate them. He is a very important man who we want to make sure gets honored correctly in conversation. So we're actually three hospitals, 80 locations all across Brooklyn. We are Brooklyn's largest hospital because from patient beds. The main hospital, the one that you guys know in Borough Park down the block, also has a hospital within the hospital, the only children's hospital in Brooklyn. We also have a community hospital based in Midwood. So those are the three hospitals that make up our campus. Outside of that, we have multiple locations throughout the borough of Brooklyn, from medical offices that we're affiliated with, to the only cancer center in Brooklyn, to the only stroke center in Brooklyn, to an orthopedic center. There are many different locations and resources that we have. So you should see our banners and our locations across Brooklyn. We're very proud of the numbers we serve: 320,000 unique patients served, 35,000 annual inpatient discharges, 800,000 annual outpatient visits, 5 million, I'm sorry, 5,000 million, 5,000 annual deliveries. We have a level 2 pediatric trauma center that I'll be discussing at a later time, prenatal center that is world renowned, and we are a breast center. There are numerous specialties that I won't mention, but our hospital has some of the best clinicians in the country, and we are very, very proud to serve the Brooklyn community. Now, on site, we have, as Douglas likes to say, we are the United Nations here in Brooklyn. We have over 100 languages spoken, including American Sign Language, with interpreters logged for all of the languages. We host countless health educational events, breast cancer screenings, and numerous other events that impacted about 30,000 people over the years that we've been doing them. I'm very interested in partnering with community groups to do community education events. So if you think our hospital should be talking about cancer prevention or stroke awareness materials, if you want somebody to present at a career day at a local high school, I'm your point of contact. We very much want to be a hospital in community with community, and there are quite a few medical professionals on staff that are very eager to find an audience ready to hear the wealth of information that they have. And I would love to collaborate with any community organizations on the call to get our medical professionals in front of those groups to share the resources and information we have. We also have a vast volunteer operation with over 1,500 volunteers contributing over 30,000 hours in 2023, from our doulas to our companions to the various other volunteer network programs within the hospital. Our community health needs assessment is currently underway. Some of you may have participated in order for us to do uh, our community survey on what the needs of the area we serve are. The last survey was released in 2021. I believe the next survey should be releasing in the next couple of months. So Maimonides is a leader, as a community partner in many ways. We have multiple relationships. We are the largest independent medical center in the country right now. As some of you may know, a lot of hospital consolidations have occurred, but we have managed to stay Maimonides Hospital since our inception. And we have a 500 person medical team with interns, residents, and fellows that are active annually as a teaching hospital. We are conducting a partnership with SUNY Downstate, who provides us accreditations for several of our departments, including our neurology department, which allows us to both teach and serve in a very high level people of Brooklyn. We have relationships with numerous other hospitals in the Brooklyn area, including South Brooklyn Health, Kings County, Northwell, One Brooklyn Health, and we're a part of several physician networks that you might be aware of or your doctors might participate in, such as Maimonides Doctors, which is an independent doctor collective affiliated with the hospital, KIPA, and Community Cares of Brooklyn, all of which are different physician networks that are affiliated with our hospital and allow us to keep a standing dialogue with the doctors throughout Brooklyn. We are a safety net hospital. For those who don't know, a safety net hospital must either be a public hospital, a critical access hospital, or a sole community hospital, and it must have a certain patient makeup indicating its importance to the community it serves. The specific definition is on here, but more importantly for us, 50% of the number of patients discharged in our hospital in 2023 were insured through Medicaid. That is compared to the 20% of the population that receive Medicaid across the state. So we receive a significant population of Medicaid patients, either people in need of support or people with a high risk medical condition that qualifies them for Medicaid. They turn to our hospital as their provider. Because that is such a significant form of coverage for people, it makes us a safety net hospital because our funding in total with Medicare included comes about 80% of our funds come from Medicare and Medicaid, which means we're very dependent on those government programs that serve our elders and our most needy in order to cover the operating costs of our hospital. So that classification again is called a safety net hospital. Some of our priorities as an organization in the foreseeable future, our number one priority is to transition into Epic. For those who don't know, Epic is an electronic medical record system. It is the new standard of care for hospitals and medical systems across the country, allowing your doctor, the patient, and the medical team at multiple locations to communicate seamlessly. If you take a test, the test is available to every person involved in the supply chain in order to make sure that your information is protected and available in a convenient way. We do not have access to Epic. It is one of our priorities to transition to Epic as quickly as possible. We also have a Brooklyn-based strategy, developing as much relationships with the Brooklyn community as possible because we pride ourselves in being the Brooklyn resource. And strengthening those relationships, deepening those relationships is one of our central priorities. We also have a priority for our Midwood Community Hospital, which is our newest hospital. It is only a few years integrated into our system, and better integrating it and the community it serves into the Maimonides family is one of our priorities. We are also trying to get a 3-star rating from the Center for Medicaid and Medicare Services, the federal agency for the services we provide. And we are constantly looking to get new Medicaid waivers, which would allow us additional funding through the state program that is a significant portion of our budget. Some recent system achievements that I just want to make you all aware of, and we're only going to go over the last few years. We opened our Maimonides Doctors Pavilion. That is the new wonderful location on 9th Avenue that we have that houses many of our doctor specialties. We launched MyMo Care, our application that allows patients to uh, access some of our health resources a little bit more availably through some modern technology. We have a new infusion center, a new MRI and PCI lab that have opened in the last few years. Something very special to us is our new Bay Ridge emergency room that we opened recently. For those who have not seen it, I would be happy to schedule a tour. It is wonderful. It is part of our strategic plan to triple the size of our emergency room with the opening of the Bay Ridge Emergency Department and some of the other emergency room expansions I'll be discussing. We will be announcing a threefold increase in our emergency room square footage, thanks to the investments that have been put in place with the support of our state partners. Infrastructure improvements, we're happy to celebrate, including expanding our NICU and our PACU renovations to our new diagnostic labs. We've enhanced staffing through robust recruitment to address some shortfalls we've had internally. We have renovated our HVAC system. We have quite a few things going on, and even more recently, in the last few months, we have celebrated the opening of our psychiatric emergency department, something that I'll be discussing in my next slide. And we're going to be announcing in the coming weeks the opening of our pediatric emergency department. We also have new catheterization and EP labs scheduled to be opening soon. Some emergency department imaging equipment will be delivered soon. And we are hoping to start moving forward with turning the 10th Avenue underpass of the hospital into a pedestrian plaza to create more open space for our patients and our staff in the near future. Back to our psychiatric emergency room, where we had a wonderful ribbon cutting on July 24th. Thanks to a $5.3 million bond that the New York State Dorm Authority provided us, we were able to renovate space in our basement of our emergency department to allow patients with mental health conditions, dealing with incident, to find a quieter space outside of the very loud, very active emergency department where they could find medical professionals and quiet to regroup themselves during such a traumatic moment. The new emergency departments, the psychiatric emergency department was designed to allow people in those moments of need to get the space, peace, and specialty care that they would require in order to deal with that situation. We're very excited about this new space. It's the first space of its kind in Brooklyn, and it is one of the many expansions that I mentioned to our emergency department. It's a fourfold increase of the previous space. Just to give you a comparison, it has, I believe it's 4 full rooms and 6 beds and a nurse's station, allowing us to serve a lot more of the mental health needs of the community. We are also going to be having a ribbon cutting sometime in October for our pediatric emergency department. For those who have been on campus on 10th Avenue under an administrative building across the street from our main entrance, we have been renovating the first floor to essentially double the size of our emergency department by moving our pediatric wing of our emergency department across the street to 10th Avenue. That will allow the children of our hospital and the children's hospital to have a dedicated emergency department and allow us to fully envelop the existing footprint of our existing emergency department for our adults. The pediatric emergency department is a significant investment for the Brooklyn community. Nationally, the pediatric departments of hospitals across the country have decreased by 19%. It is a trend downwards, but in Brooklyn, that trend is upwards. We are going to be quadrupling the size of our existing pediatric department with this ribbon cutting, with children-friendly design, 34 treatment rooms, and some advanced imaging equipment that will be able to serve the children and families of Brooklyn. It will be officially designated a level 2 pediatric trauma center. Again, it will be the only children's emergency room in Brooklyn of that kind, with over 30 pediatric subspecialties available as a part of our children's hospital. For those who are new to this, as a person who's learning it myself, I'm a lifelong public servant learning about hospitals in this new role that I have. The best way of understanding it is A children's hospital provides an umbrella of care that allows any child with any condition to have specialty care available to them on site. And you can only call yourself a children's hospital, you can only call yourself a children's trauma center if you have the resources on site to treat the conditions that could come to you. And the higher the designation, the more resources available. And we are a children's hospital. We are a level 2 trauma center, which means we have some of the highest quality pediatric care a child of need could receive in Brooklyn. This entire project is thanks to a $141 million bond issued by HUD and the Dormitory Authority of New York. And that means that Brooklyn, which has about 600,000 children, equal to the population of children in Boston, will have one children's hospital comparison to Boston, which has 3 children's hospitals. So we are still behind as a borough, but we are a step ahead of many other localities just like it. And I say that statement to just keep it all in perspective, in that thanks to advocacy on a city, state, and local level, we have gotten significant investments in our emergency department, but we are still in need of more. And when you hear about our call for need, I hope you stand with us because we are an important resource for the Brooklyn community. That was the last of it. Any questions? I want to open myself up to questions and opportunities to collaborate, because part of my job here is to also open up the hospital to partnerships with the network of communities out there. Should I do the calling on people, or?
Well, people could just, we don't have that many people could just speak up.
Stella Kokolas is.
Oh, you see the hand?
Yeah, I just see the hands raised. So
Okay.
Stella, you could unmute yourself. You're muted.
Hello.
Hi, Stella.
Yes, I have a question. Very informative information about. We live in a close neighborhood that we do know. I have 2 questions for you. Although you are very discreet, very open in analyzing the services you provide. In the beginning, you said that Maimonides has been connected with the downstate for academic. What do you mean? Because all these services that you offer are very high and very good. However, I would like to know what do you do for the academic process, progress, whatever you can put on the question. Do you have research programs, or you have combined internship programs? What do you have from that side? Do you
Gotcha.
have any connection? In other words, when the medical students go for the internship, do you have a connected internship that is approved by both, or the residents can go to both hospitals for a specific training for cardio or for pediatrics or whatever? Do you have connected somehow training, or those are separate? And what on the training process, what do you do to modernize with the new methods, with the new ways to improve medicine in general?
Those are some great questions, so thank you so much for that. So our partnership with SUNY Downstate is best understood as SUNY Downstate is a college with a small hospital on site, and we are a large hospital with no college on site. So SUNY Downstate provides us opportunity for our physicians to actually teach in classes. Some physicians want to be educators and they take that opportunity up, but it also gives us an opportunity to employ the teachers that they have within specialties. For example, like the neurology department, their neurology department is extraordinarily gifted, and we integrated their neurology department with our neurology department so that a person who is a physician with SUNY Downstate can care for patients in SUNY Downstate and also receive credentials and patients from Maimonides Hospital as well. So that synergy of teaching on site at SUNY Downstate and actually receiving credentials and providing care at both locations is a way a medical professional can do both. As for the students of those schools, they are given internships from the medical school, SUNY Downstate, in our medical programs, filling our need for resident medical interns throughout the year. As for college students, not medical students, we have a robust internship program that partners them administratively with the different departments on the hospital. I mentioned 1,500 volunteers. Many of them are interns, especially summer interns. You should see our campus during the summer. There is a small army of college students getting different levels of academic experience by participating in the different departments of our hospital. So we are very proud of our ways to educate the community, and we would love to partner with any group that is trying to support education to see if there's an opportunity to be a pipeline into our hospital.
Very good. I have a second question, if they allow me, if the group, can I go ahead? We have students.
Let's make it brief, the question.
My second question, third question rather, is we have students who study medical profession, the medical schools. They attend in Israel and in Greece and in other countries of Europe. When they come here, they have to really register for the training. Some hospitals do accept the record from those universities, some don't. It happened to be involved with these students who study in English, medicine in Greece and in Israel and in other parts of Europe. And they have difficulty to be admitted to the training programs. Do you have any kind of way or any openings for those students, or could you really find ways to accept for the internship programs of those students who have finished medical schools in English but outside of the USA?
Yeah, it's another great question. I would have to answer it in a general sense because each college in each country has a completely different educational experience. But in general, we do partner with different academic facilities all around the world to credential students. Depending on the country, depending on the standards of practice for their higher education system, our ability to acknowledge those credentials varies. If there's a person or people in mind that you'd like us to work with, I'd be happy to connect you to our medical team so that they can have a more structured conversation about whether or not those credentials are transferable.
I
But this is
appreciate.
something we've done.
Thank you.
Okay, next we have Matvey. Oskar, you can unmute yourself.
Okay, thank you. First of all, thank you so much for your presentation. It was very informative. I actually have a one question. So my agency works with the homebound seniors. So I was wondering what's the percentage of the people who are considered homebound and 60 years of age and older who are patients in your hospital and the medical center in Midwood?
That is a good question. The thing that I know about Midwood is the amount of beds Midwood has, but I don't know the specific makeup of who are in those beds. I would have to actually ask Midwood for the latest because that number fluctuates. Patients come and go. I know Midwood as a hospital has 175 beds. If you could help me, like, maybe this is something we could take offline. If you could help me understand how you would use the data could get for you would be more valuable. So we have partnerships with rehab centers, with at-home providers. If you're looking for us to work with you on something, I'm definitely happy to facilitate that kind of partnership.
Yeah, that basically the question that was like leading for me to asking for your context, because I was actually looking for the context on the presentation so I could take a screenshot. So I would assume I need to ask community board if like they can share the context, or is it okay with you to share the context with me?
I'm gonna drop my email in the chat right now.
Okay, thank you so much. I don't have any questions. Thank you.
Great, thank you. Senya, French Patty.
Hi, Amir. Welcome. My name is Senya Franjapani. I am the Director of Social Services over at the NIA office, as well as a community board member. We do have a long relationship with Douglas and Yitzi. What I wanted to know is the mental health department still doing the fast track intake? Do you know?
I believe so, but I'd have to double check for you. If you could drop your contact information in the chat, I'll follow up with Dr.
Sure.
Taub. He's the head of our mental health department, and he'll be able to give me an answer.
Okay, and my other question was, is downstate still using I'm sorry, Maimonides, ambulatory? Are they still
S-
so
I- So you're talking about the hospital that existed in the Bay Ridge location.
Victory? Yeah, the old Victory.
Yes. So I don't think we incorporated their fleet into ours because
Uh-huh.
just so you know, ambulances have a shelf life of about 3 years before they have to be replaced. They're driven pretty robustly. So
No, I'm
we
sorry.
have,
I'm sorry to cut you off. No, the ambulatory department, like is ambulatory surgery, is downstate still using that location
oh,
for services?
yes. So as far as I know, downstate is fully operational. They have not seen a reduction in services. I don't know if you're asking about the closure conversation that transpired last year,
Yes.
but since then there's been no closures of any services at downstate. Their collaboration with us has increased to maximize the utilization of their resources.
Okay, and now as far as the triage that's at Victory, which is Maimonides, what are the other services being offered to the community? Just the basic standard. Obviously, if someone needed to uh have an overnight stay or come in, they would be transported, I assume, to Maimonides?
Yes, so the Bay Ridge ED is an extension of our current emergency department.
Okay.
So it's the same staff, the same nurses, the same people who you'd find in the emergency department at our main location get shifts stationed at the Bay Ridge location. So it's an annex. Your experience at the Bay Ridge location will be seamless to your experience in the main hospital. You would be treated. If you are required to be intaken as a patient, you would be transferred from the emergency department straight into whatever floor you're supposed to be treated in
Mhm.
within the main hospital.
Okay. Thank you, Amir.
Thank you.
Okay, next I am delighted to say that Jana Toby is here with her hand raised and a question. Jana is a former older adult issues, housing, health and
Yeah.
welfare chair, and CB10 member. So it's nice to see your name, Jana. You have a
Hi,
question?
everyone. Yeah, I will put on my camera and say hi in a bit. I'm going to get to a safer location. It's
No.
so good to see you all, and thanks so much for having this event. I'm joining today actually because I'm very interested in the topics and also because I now work with Bay Ridge Center, who is servicing the older adults in our community. So my question really is directly on how, if you're the point person, and how we can help our homebound seniors. Do you guys have services for people that can't leave their homes? And also when we do send them to hospital, if they don't have any family member, do you guys kind of have a program to assist in navigating that? I find that a lot of the elderly might not have anyone, and then they kind of go in, they're lost, they have a lot of maybe names and nurses, but there's no point of contact. And the other question that I would have there, I know you guys have the home medical care for the elderly program, so I don't know if that's still working, or the Safe at Home initiative. So I was wondering if those are still active and how we can kind of get information about that.
Sure. So my contact information is in the chat. If you don't mind putting yours in the chat, I'd love to actually get some time for you to actually meet the people who run those programs if you really want to get into depth on it. I will say on a very high level, just because I don't want to step beyond my level of expertise. We do provide intense home care. I will say the key point is the person that receives the care would need to be identified as a patient for us. We have social workers available to be assigned to those people in order for them to get access to the services and care that they need. The ultimate question, though, is the person who's homebound a patient of ours, or are they part of another network or another service provider? For example, there's existing homebound medical organizations that could be providing sustainable care to that person, and they would just come to us for their medical treatment while they have their own standing social worker to provide them with all the other support services available.
Great. Okay, so I'm gonna add my name, and if you could add your contact information before, because I don't know that, I didn't see it.
It's in the
Gotcha. I'll
chat.
drop it again. I'll drop it
Yeah.
again.
Thanks so much.
Are there any other questions from here? Otherwise, we will move on because we have a long agenda. to
Yeah,
follow.
actually, Ruth, I just have one quick question that someone
Oh, sure.
watching on YouTube just sent me via email.
Oh,
Will SUNY Downstate used to provide annual flu shots at the center at their location that's now been taken over by Maimonides. Does Maimonides plans to have free flu shot days or events this upcoming season?
So we are just getting started coordinating our flu shot events for the upcoming season. If there's a point of contact for an organization looking to do flu shots, I would love to speak to them. So it is still perfectly timed. If that person wants to reach out, again, please drop my email in the chat for that person. I'd love to collaborate. Ideally, we would like to speak to somebody who actually represents the organization. So maybe it's either them or they can introduce me, because the logistics of how it would work is something we would have to nail
Okay.
down.
Yeah,
But if
this
it's been
this
done
was
there
just
before,
this was a resident who used to walk in.
Yeah.
And so
gotcha.
I guess, that was a popular annual event.
We're big on flu shots over here, so
Yeah,
any flu shot location that makes sense we would love to collaborate.
great. And there is Jana on camera. Hi, Jana.
oh,
Hey,
Oh,
guys.
nice to see you. Okay, Ruth?
okay, so Amir, thank you so much. That was quite a huge amount of information.
Thank you for having me. I will send you the slide deck, and hopefully my contact information will circulate. So if anybody has any follow-up questions or wants to collaborate, I look forward to it.
It's
Perfect,
great.
will do.
So it's really important for all of us to hear all this information about our local hospital. I have to say, I didn't know most of that myself, so thank you for that. Next on our agenda, do we have a representative from the
Hi.
FDNY?
I don't know if FDNY member is an attendee, if you could raise your hands, I'll promote you to panelist. I have two names of people who are supposed to be here. Assistant Chief
Okay.
Kathleen Cross or Assistant Chief Paul, and I don't see those names here, Ruth. So if you want to
Okay.
move on to the.
Yeah, we will move on. We have a representative here from Bravo to give us an update. So please introduce yourself.
Good evening. I am Tony Napoli. I am the president of Bravo Volunteer Ambulance. For those of you that do not know, or I want to say, I won't embarrass anybody. We are the local community-based volunteer ambulance corps here in the Bay Ridge, Dyker Heights, and Fort Hamilton communities. I like to say, my daughter says, be straightforward and to the point. So I have 7 points I'm going to make, and like really right out there. First of all, obviously, like I just said, Bravo is still here. We are alive and kicking. We are
To that, we say bravo.
Thank you.
Yeah.
We are in our 50th year, and people say I don't look that old, but I will admit I have been at Bravo for 50 years. So I am one of the original members, but not the founding members. So there's a little bit of a difference there. But yes, we are still here in Bay Ridge and Dyker Heights. Second thing, we continue to be an absolute all-volunteer ambulance corps. Nobody, absolutely nobody in the organization is paid in any way, shape, or form. Everything is 100% volunteer. We're physically located at 86th Street and 7th Avenue in Dyker Heights, and we own two fully certified ambulances and have always maintained fully certified ambulances through New York State and through the New York City system, and I'll talk about that in a minute. We currently have 80 senior squad members, and we have 30 youth squad members. We have a vibrant youth squad, which consists of our teenagers between the ages of 14 and 18. We do different events with them. They basically support the senior squad in fundraising and community events, and you'll see them at most of the events that we participate in. We are not 911, and that is the probably the biggest thing that I'm going to lead into. You must continue to dial us directly at 718-680-1111. That's been our number for 50 years. In order to request a Bravo ambulance or request that an ambulance responds to you or to something going on in the community. We acknowledge, and I am always straightforward with this, we acknowledge that we are not in operation 24/7. It doesn't happen. That's something in the past that took place. I'd like to say I wish we can get back to that, but things being with the political light and financial plight of everybody, it's almost physically impossible because people are working 2 and sometimes 3 jobs, and they simply do not have time to volunteer. And that breaks down to no volunteers, no ambulances. It's as simple as that. We don't employ anybody, so it's not that we can guarantee the members will be there. We're at the whim of who can physically come in and spend some time on the ambulance. We are fully certified emergency medical technicians, just like anybody else is in the 911 system. Most of the time, and I don't like to give specific numbers, but most of our members are members of New York City FDNY EMS. They belong to the fire department EMS because that's where they started their career with us. You always started as a volunteer, and then you developed your career from it, and then you got hired by the city. And a lot of the people still stayed with us, even though they're working for a commercial entity. So there is sometimes the same person, different uniform, but the same person. Probably the last and the most talked about thing that we'll get into is we don't have a specific hospital that we respond to. We will take a patient to whatever hospital they request within reason. We like to say within the surrounding area. So we do go to Maimonides, and I do pronounce it correctly. We do go to NYU, the old Lutheran Medical Center, and we do go to the Maimonides 92nd Street site as well because it is a receiving hospital. We will go down to Methodist Hospital, and we do go down to the old Long Island College Hospital, which is now NYU Brooklyn South. I think don't
Cobble Hill.
Cobble Hill. Thank you, Cobble Hill Network. We can go to that, but that basically depends on the condition of the patient, and obviously we will always want to take the patient to the most appropriate hospital according to what's going on. Sometimes they're not happy with us, but if we believe in our professional opinion that your patient care is at risk, taking you to a distant hospital, we will insist that you go to the closest hospital. And that's Bravo. We are what we are. We continue to do what we do. I don't know if we'll be around for another 50 years. I can absolutely assure you I will not. That is
Sure.
yeah, no, pretty sure I will not be here for another 50 years. But that's the organization. What do I ask? We ask a lot of things, and the reason I'm back at the community board, and as I said, we used to do this on a regular basis. I usually say things stop at the top, so I usually say to people, blame me. I have not been here. We should be more involved in the community board, and it's something I think we're going to try and work at and see where we can continue that moving forward. We would like to have better access into the medical emergencies in Bay Ridge, Dyker Heights, and Fort Hamilton. Mainly, put in plain English, we don't have access to the 911 system at all. It doesn't physically exist. We're involved in a situation where the community council can work with us or can hopefully lead this along. We don't even have access to the police radio system anymore under the new guidelines that the police department set that they encrypted all their frequencies. Nobody outside the police department can hear the police department frequencies. That unfortunately has also taken away all the ambulances. I'm not even talking about just Bravo. NYU, Maimonides, and any other ambulance in the 911 system who is contracted to answer 911 calls cannot monitor the police radios. So therefore, we have no idea what's going on in the community. We used to listen on a regular basis. If we thought there was a medical emergency, we would respond. It's our community. We felt that we had that obligation. If we were available, we would respond. We were born under the auspices that we reside in the community and we have a faster response time. If we could get there faster than another ambulance, that's positive for the patient. But we can't do that anymore. There are a couple of, I don't want to call them bills. There are a couple of proposals that have gone to the police commissioner. I think they've had a change in personnel also, so it's gotten caught up in that also to who approves it. But they haven't approved that yet. So we don't know what goes on in the community as far as emergency radios are concerned, unless somebody picks up the phone and says, hey, Bravo, this is going on. Hey, Bravo, there's a car accident. Hey, Bravo, somebody fell on the sidewalk. Okay, Bravo, I'm having chest pain. Can you call? That doesn't happen. We don't respond. It's not there. We might be in the community where we see something, I mean, which was what we try to do on a regular basis. But that's about where that comes from. There is no last point I wanted to make. There has been in the past ways that that FDNY, I should say, as EMS, not under FDNY, has attempted to involve the volunteers. Has taken place in the past. That has since gone by the wayside, and it basically doesn't exist. And the reason for that, I shouldn't say doesn't exist, is very limited, is the commitment of time and the commitment of the cost of the equipment that they require the volunteer cause to put up front and to purchase. And that's been a very, very difficult transaction to take place with. So that's basically our story.
So if we want to call you,
I have to ask her first. Can I?
No, yeah, especially was ready.
Okay, okay.
if we want to call you for any emergency or anything, how do we get through to you?
You have to dial our phone number,
680-1111.
718-680-1111.
It's on,
Right.
And you
have a-
come
it's have a
right away,
magnet.
or
If we have a crew available,
Yeah.
we will come as fast as we can. Nobody says we will respond right away because that presents other problems. You know, you don't know what happens. You don't know if they come across something else. We always respond as soon as we can. Most of the time, I will say, most of the time it's within 2 or 3 minutes.
And my second question, if you please, do you have medical people in the car when they come? You can help.
Every crew consists of a minimum of 2 emergency medical technicians. Those are New York State certified minimum training for an ambulance.
I see. Okay.
One question. And by the way, bravo, because we had to use you a couple of times over the years and you guys were just great. But I was wondering, so if someone's in distress at home, pick up, instead of calling 911, if they call Bravo, right? Instead, how does it work, like, as far as, I mean, you guys are all volunteers, right?
Yes.
So is there, like, does the insurance not cover or not cover it? Is there a charge then? Because it's volunteer, how does it work versus the other ambulance?
Fortunately, in the past few years, New York State has changed their insurance regulations, which now allow us to bill the insurance company for taking care of you. We do not send a bill to you. It is only to the only to the insurance company. That's a recent change that has taken place. We have only started doing that within the last 2 years. I don't even think we're coming up. We should be coming up on our 2nd anniversary, but that's all we've been doing. Up until now, every dollar that we have received, other than coming from, we talked about it before, other than coming from the city council generosity of community services, every dollar has been what we've raised within the community. It's been 100%, I don't want to say 100%, but it's been all donations.
So from an insurance perspective, is it gonna be markedly different? Let's say somebody who's doesn't have so much money or is not covered by a lot of
you know, their stuff isn't covered by insurance that much, maybe they're on Medicaid or something. If they call Bravo versus 911, is there a vast difference in what it would cost them? Or
From what
the
I
insurance would-
understand, every insurance company is different.
Yeah.
I do know that they all pay different amounts. I can tell you just in general, we do not bill as high as the local hospitals do when they
Yeah.
respond.
If I could, if you don't mind me adding to that, the coming from someone else who's worked in EMS, the major difference is that if your insurance company only pays $200 to Bravo, that's all they will take. If your insurance company is only willing to pay $200 to FDNY or $200 to Maimonides or NYU or any of the others, then they're going to send you a
They're
bill
gonna
for the
send-
difference.
right,
They
right.
will not balance bill you. They'll only bill the insurance. That's the major difference.
Call Bravo.
Yeah.
That's why they have no
Well,
money.
That's right.
That too.
They have a lot of generosity.
Good point.
That too.
Do you mind if I ask you to speak to one more thing? So part of the reason that you know I reached out to you about coming to visit us is to follow up on this conversation that we had at our last meeting about the FDNY regulations on going to the closest hospital. I wonder if you could maybe update us just a little bit on what they're doing and tell us how Bravo kind of fits into that.
Well,
yeah.
okay, going back to my previous point,
Yeah.
we have no regulations as to what hospital anybody will go to except medical necessity.
Right.
So for example, the gentleman from Maimonides was very accurate in what he was saying about them becoming now a pediatric affiliated trauma center. So pediatrics would then be, if you were pediatric trauma, you would be, I don't want to say use the word steered, but you would be we would go to that hospital. NYU is a local trauma center, is our closest trauma center when we look at location, basically to the Bay Ridge area. So we will respond if you were seriously injured. We would take you to NYU. Probably even if you kicked and fought and everything else, because that is the appropriate hospital to go to for your condition. What you're referring to is the fire department has initiated a plan, and not that I like speaking for other entities, I was hoping that they were here too.
Yeah, we'll
That-
we'll
that-
make sure they're here at the next meeting.
that
They
they-
did respond, yes.
that they would say it,
Yeah.
but the fire department has initiated a policy that's specifically picks the area hospital based on your location that you should be brought to. And if you are choosing to go to another hospital, not of those two, the crew will not take you. They have to
Really?
go, they have to go
Yeah,
through
yeah.
a lengthy procedure of contacting their online medical control, which are their doctors, who you then speak to, and their numbers are quite high that they do not approve it.
Now, why did they change that?
I don't want to speak.
No, yeah,
Sure.
we'll wait
No,
for the fire
The problem is if
department.
they take you to a
comes and speaks
hospital
you.
when you don't have a doctor,
That's right.
and then it's very hard to get transferred after the fact, once you're in.
That's right, which is a good reason to call Bravo.
Oh, Bravo.
Yeah.
Yeah.
Well-
Whatever my speed down
And
there.
if you don't mind, I would just add one more aspect to that. A hospital that is not included among the choices when you call 911 is the Veterans Administration Medical Center. Because it's not an emergency department that's open to everybody, so therefore it's not included in the choices. And I can speak to this directly. I work as a nurse over at Staten Island University Hospital, and I've already treated a number of veterans who are very frustrated that they ended up in our emergency department over there because they were told by EMS crews that they're not allowed to go to the Veterans Administration Medical Center anymore. Of course, Bravo can take our veterans to the VA. But the fire department, except in very limited circumstances, is not doing that anymore.
That's
Yeah,
crazy.
so
Wow.
And I will say, and then we get the phone call.
it's a good thing.
That's
It's a good thing we have you.
Good
Not
thing
all
we have you,
neighborhoods
yeah.
are that are
Yeah.
a lot of neighborhoods have no other choice than to call 911. Yeah.
We definitely have to promote you some more.
So I have
Tina?
two questions for
Go ahead.
you. My first question is, you said you're not always, you don't always have volunteers, so you don't have someone available. So, when someone calls, do they get a recording or what happens if someone calls in and you're shut down?
It's actually one of both. If we have somebody available to take the call, and we also have people offsite that also do receive the calls forwarded, they will answer our emergency line on the 1111 number. They will answer immediately that this is Bravo. We do not have a crew available. Please hang up and dial 911. They don't even entertain you in a conversation.
Right.
It's just
Right, they
hey,
wanna waste
hey,
time.
right. We don't need to know. I don't need to know you were in the neighborhood and
Right.
just because I hear these things, you know, as a neighborhood, we've always used you. We've always, even some people even say we've always donated to you. There's no reason to enter into a conversation. The answer is you're calling the emergency line. This is an emergency. We don't have an ambulance available. Hang up and dial 911. It's more appropriate at that particular time. If nobody is available to answer the phone, you receive a voice recording, it's a voicemail, that says exactly the same thing. It says, you have reached Bravo. If this is an emergency, please hang up immediately and dial 911.
Mm.
And goes that route.
The other thing is I'd like to ask you to speak about Bravo's serious financial situation and your efforts to do fundraising. And I think our committee and then the entire board will hear about this when I give a report.
Thank you for that. Obviously, as we've said, and I don't think there is anybody who will ever do a presentation to any of you that will deny that they need money. I mean, that's the bottom line. We all know that. Even the community board, I know you fight on your own battle to try and get money.
Sure do.
We're in the same predicament. So I like to put things in simple fashion. An ambulance today that responds to any call cost $250,000. So when I start putting numbers together for people, so take that number and basically say, okay, let's start dividing it down. How many people have to donate to us, or maybe we have to bill or respond to, that get us to that number? It is very, very low. We still rely on the community and community fundraising to raise money. This coming Saturday, make this a sales pitch.
Yes.
This coming Saturday, we are hosting a comedy night at Our Lady of Angels School at 7 p.m. Tickets are $35 if I make it a sales pitch. Anybody can show up. We're selling tickets at the door. But that is 100% of that is money that goes directly to us. It's not going to anybody else. It continues to pay for everything we use. In November, we are doing a basket, what we call a basket fling. You used the phrase before. It's a penny auction. It's basically raffles. We usually have somewhere in the area, if we go with what we had last year, usually it's somewhere in the area of 125, 150 baskets. I mean, so it's not like we have 10 baskets. We have a lot of baskets. We accept any donations of new merchandise from the different areas, from the different vendors around us, from the different businesses. Gives them a chance to advertise. We hope that they donate to us. We then auction that off, or we raffle that off in order to raise the money for that night. And again, that's all the money that goes directly to us. That's November 15th. You can ask me when that was.
You know, two questions.
Go ahead.
First of all, I used to get envelopes in the mail from Bravo looking for donations. I haven't gotten an envelope. I get an envelope. I usually fill it. I put a check in there. So that was the first thing. Second thing, I wanted to invite you actually to come to the next Merchants of Third Avenue meeting, because all the businesses are there. I'm on that
Right.
too. And, you know, then you could make a pitch there, because to
Okay.
get for the raffles, you know, the different restaurants, they'll get, you know, hit them up for a gift certificate.
Please invite me.
You know, I won't be at the next one
That's okay.
myself. I'll be away. But I definitely, if I get your contact, I
We'll
can.
take care of the invite
Yes,
and we'll.
yes.
They have, you're right, they have,
That's-
they're
that's okay.
having it in the morning. And where did they say they were?
I don't know whether
I'm retired.
Gonna be there.
Here's
so I- Yeah,
you-
it's- I
Make
mean,
sure you leave
a
your
morning
email
was like
address.
at 9:30.
I'm sure I have it. I'm 99.9% sure I have it.
I wasn't there, no.
No, you weren't, but you're
I-
right.
I'm retired, so
It's all good.
it's.
Yeah, they're doing it at times that are different during the morning, usually it's in the evening time.
The to get back to the other thing that you brought up as far as the envelopes, it hurts us that we can't send out envelopes, and this is really going to be the last attempt we went to do that was the astronomical cost
Mhm.
of sending letters to just the neighborhood. I'll give you straight out numbers because I was the one doing it. It was going to cost us more than $15,000 just to get the list of residences in the neighborhood. I think that's ridiculous. I think that's absolutely crazy. Then it's the cost of the printing and everything that goes with it. We were looking at, and again, we're a community-based organization. I use, like say people, we're an open book. It looked like it would have cost us over $20,000 to do a mailing
Yeah,
with, and I'll be a little frank with this one, with no guarantee of a return.
yeah. What about social
And
media?
we-
Posting on social?
We do. We have our own Facebook page. The
Mhm.
community board has it. Bay Ridge Talks. We usually have the stuff in there. But for the people that don't go on social media, that don't got sucked into living by this, it doesn't get out. It really doesn't get out.
My mother still has.
The magnet.
Has the letter, has the sticker, the sticker.
The sticker, I have it.
It's right
Well,
above her
the first
telephone,
I'm gonna go one step further. Where is it?
right above the telephone.
What's that?
What is that?
Oh, what's that?
A telephone, yeah.
That is exactly.
Is it a rotary?
No, it's not.
That is exactly what
I'm okay.
we've gotten involved in, which
We're lost without.
we're all,
It's true.
Sure.
We're beholden.
we're all
to
here.
them.
But
Um,
this is, as like I said before, thank you for at least inviting us. I'd love to get involved with the Merchant Association. I have no problem addressing the
Great.
entire forum
Mhm.
if you'd like us to. I'll leave with this because you definitely know I'm a politician. I don't want to say politician, but anyway. It's a vicious circle and it's unfortunate. We're stuck in a vicious circle. I need volunteers to run the ambulance. If I don't have volunteers, I can't put the ambulance out. If I can't put the ambulance out, we can't do any billing. If I don't have billing, we don't get the money. If I don't get the money, we can't buy the equipment. Can't get the equipment, I can't have something for a volunteer to come into. And I'm back to square one. And the circle keeps going around. It has been my tenure now that I'm back involved with the organization that I'm trying to get that I used to call it a counterclockwise action. I'm trying to get into a clockwise action. I'm trying to slowly bring it around, and we go in the opposite direction. That we're receiving the money, and we're receiving the money. We have the equipment and the modern equipment that we need to provide for an EMT to be on the ambulance, which will then draw EMTs to want to come because they have new stuff they want to play. I usually say, give them the new toys,
Yeah.
and they will come and play, which will get them out there. If we have a little bit better with success with the 911 system, and Staley has
This
said
is something we should
brought up,
continue, we should pursue.
if we have a
Yeah.
little better luck that we can gain access to it, and we're not asking for a lot, and I know I'm going along, I'm sorry. We're only looking for access to the 911 system to the 6A precinct. We only respond to the 6A precinct. We don't go out of the precinct. New York State mandates that's where we stay. It's called the Certificate of Need. Bravo's Certificate of Need issued by New York State says that we remain in the 6A precinct. There are exceptions where we can go out of the area for an assignment. I'm not talking about to go to a hospital, but we are the 6A precinct.
The captain usually comes to our meetings, even
Yeah.
come
I
last.
have one more question. There are other neighborhoods that have
Volunteer.
similar
Mhm.
There's
Bravo.
probably 20 in the city.
I know that Hatzawa in
Mhm.
Borough Park is a very successful one.
Yes.
So I'm interested in knowing if you have contact with Hatzawa and with other volunteer ambulance services to find out how they raise their funds and what they do to make it work?
Yes, we do. We actually belong to it's called the New York State Volunteer Ambulance Association. You brought up, you said I think we are down to 24 ambulances in the Brooklyn and Queens area. We were up at 46 maybe, so we are already, we just lost Bensonhurst Volunteer Ambulance, if you know or don't know. This New York State has now officially shut them down, so they are now out. The closest volunteer to us is Park Slope Volunteer, which is more on the lower side of the numbers. But we stop at 60th Street and 14th Avenue. That's our double split. If I even look at your map, 60th to the shore, and we take 14th to the shore, and that's our response area. If we go here or come to know of an assignment in that area and we're available, we will respond. And that's all we're looking to do.
There's one more question. Carmelo, you have a question?
Yes, just curious, what is your annual budget? What was last year's budget?
Last
And
year's
how much of it is, let me just give the follow-up. How much of it is grant money and money allocated by our electeds? And how much is fundraised? I mean, it would help us steer you in the right direction.
No, you are. That's okay. Last year, our operating budget was $168,000. Of the 168, we received $35,000 from New York. I lost the word. Help me.
New York State?
No. New York City Community Board,
okay.
not Community Board.
Community
City
Council.
Council.
City Council.
City
Thank you.
Council.
My apologies. From the New York City Council, we received that through them. Other than that, we have no specific grants that are directed to us other than what we try to get every year. The last grant that we were in receipt of was a FEMA grant, which was received from Matilda Frontis before she left office. And I understand she's back in office. Somebody just told me can you guys help with that?
Like 93rd
All right.
Street off the third.
Yeah.
Anyway, we received a federal grant from her for $125,000 to buy an ambulance.
Wow.
We are sitting on that grant right now. We have not enacted it because we need to raise the money for the other $125,000 to pay for the ambulance.
Oh boy.
We have been, and again, all the money that we've been receiving has been donations and or billing that I said we've only done in the last 2 years. A good chunk of our funding always came from donations, but it also came through the generosity of people in the community that left us as a beneficiary to them, and that as a bequest, and that's something that we are greatly endeared to, where we receive money, unfortunately, with them passing on, and I don't want to wish that on anybody, but
so you've only been billing for 2 years?
No, that's it. As a matter of fact, it's not even. We haven't. I don't believe we've reached our 24th month yet. I think we're just coming up on it.
When you saw how much billing you did in 2024,
yes.
And I'm sure it wasn't like complete. I'm sure there was a lot of starts and stops there.
Correct.
How did it compare to your budget?
To the budget?
To the revenue. How much revenue versus how much your cost was? And obviously, I'm not looking for you to make any money. That's never the case. But we're looking at a volunteer ambulance company. But I'd like to see if that number does help and comes close to covering some of the shortfalls.
Right. We estimated that right now that will account for about 33%, 1/3 of the total cost of running the service. The rest of it falls back on money that we've acquired in the past and that we still had to us. But unfortunately, that cost number, the operating budget, it doesn't go down. I have to tell you.
Doesn't move.
It doesn't go down.
Doesn't move.
It's only going up, and it's getting worse. We don't like to look at it like that. I mean, I've been put on a pulpit for many things, as I will say, Bravo will exist until we spend our last penny. That is what we are committed to. We are not looking to shut down. If I can help one single person, that's one person more than would not have gotten it if we weren't around. So we still continue to do our best. And we do have people that I want to say love us, that do care about us, that do take the time and put in. Obviously, our volunteers. I can't say enough about me, us, and everything else. But that's what we're here to do, and we're going to try to continue to do it. And if you can help, we greatly appreciate it. Staley has brought up, as I said, the conversation. We'd like to keep pushing that conversation forward. We would just like to know in general. I leave that with what I said. Our biggest problem, we'd like to know what's going on in our area.
And I think this is one of the things we can really do. And on this board is make those connections and have those conversations with the 6-8 precinct or with FDY EMS and try to, get everybody talking. Because it is this resource that's sort of being ignored by the system. And it's such a great wonderful resource.
So if this decision was made about the encrypting, I mean, that's done at high levels of the police department, and we were hoping to have the fire department here, so
Very high level.
I know that, there's a lot of new rules that even we're bound by the New York identifying law, of what information we can release. I don't know the particulars about the police department, but and the fire department. We did invite them. They did respond yes. So I think, these are good questions that we deserve answers to in terms of transparency. Yep, definitely.
A little side note to that, and I try very hard not to talk about other entities and other that I'm not involved in. But I will bring up the Fifth Avenue and Third Avenue festivals. I mean, that's probably a great one to start with. We put up a medical tent at both events. We're always at 75th and 3rd or 75th and 5th. We usually teach CPR that day just because it's something we can do with the community. We don't charge anybody for it. We drag people in. I usually hijack people and I usually grab them and say, come in, just give me 2 minutes of your time. Now I'm going to teach you CPR. We do that. With that, we usually have representatives from CERT with us. That they're usually CERT, the
community emergency response team.
Oh,
Right.
okay.
They are usually right next to us. And I'm going to speak out of turn, and I apologize in advance. They are not even on the police radio.
Everyone's off.
They don't. Yeah, it was my question. I said, well, good, you're here. So if anything happens, I can hear it. And I will say, because it happened to me. He says, no, we don't have police radios. We don't know what's going on, even
What's the reason?
I can't answer that.
Yes, I know some of the reasoning, just what's out there in the press has been that there's a lot of chasers that listen to the radios and press,
I see.
a lot of these apps that the, citizen app, but,
Has to have to do with security.
security and safety.
And we acknowledge that. I mean, I'm greatly acknowledge that. But there's entities
That should
should be able to do it.
We're
Right.
not talking about.
Well, we can't make progress.
No,
with
you
that
can't.
at
We're
We're
this
not talking
point.
about any kind of breach of security. You're looking to
Right.
provide a
Service.
service to the community.
Right, yeah.
Correct. Along with the police department. I'm not excluding them and or the fire department. By all means, I'm not excluding them.
We'll reach out again. Maybe we could even do a joint meeting with the police committee.
Love to. We've tried
Yeah.
multiple times and we get.
Well, you see how
We're pretty
we've been
tenacious
trying.
there, yeah.
Yeah, we've been
Keep trying.
trying. We finally got an answer after many emails. Anyway,
Progress.
Ruth, we do have one
We have
more.
one, I know.
Um,
So thank you very much.
Really quick.
Emily.
Thank you, guys.
Gave
Thank
us a
you.
lot of
Thank
important
you.
Yeah,
information
really.
and food for thought. I think all of us should try to go to this comedy night and this basket event. Sounds like a lot of fun. It's important to support our community and certainly our Bravo.
Thank you.
And you've come to the right
Yes.
place because we like to do things.
Good.
Okay,
May I
so
skip to the
we're
rest of the
going next. To have
Okay.
a brief presentation by a representative from Catholic Charities, and that's Matthew Bosco from Catholic Charities. And we did have a presentation in the spring from Catholic Charities. And we welcome your update.
They were out of me last night.
Mhm.
Well, but there wasn't a full thing.
No,
There
it was, I'm just saying they were out of me
Maybe.
last night.
I was paying attention.
Testing you.
Yeah, I know.
Okay, Madvi?
Okay.
Hello, can you hear me?
Yes.
Okay. Hello, everyone. It's nice to see you again. Thank you so much, the community board members, and for everyone who is here. Yeah, you were right. I was actually yesterday, and I was doing a 1 minute presentation, but thanks to the community board, I can actually do not 1 minute, but maybe 3 minutes. So I will be very quick. So for those who don't know, we are a case management agency for homebound seniors 60 years of age and older that is funded by the New York City Department of the Aging. And because of that, the services are completely free of charge. And the most popular services are case management, home delivered meals, home care, housekeeping, transportation, benefits and entitlements, long term care planning, and many, many other services. Those are completely free of charge. And there is only two eligibility requirements. You have to be 60 years of age and older, and you need to have a homebound disability. And when I say homebound disability, that doesn't mean that you cannot leave the house permanently. It just means that you cannot leave as often as a person without a homebound disability. An example would be rehabilitation after surgery, or if you're attending dialysis center, that would also be considered homebound based on our criteria. So, I actually wanted to talk a little bit more about our most popular service, which is home delivered meals. I'm pretty sure a lot of you heard about Meals on Wheels, but the way our agency operates is that we have our own individual caterer. We have a different variety of foods. If you prefer kosher, halal, vegan, vegetarian, Mediterranean, Caribbean, Asian style, um, Russian, um, and many other types of meals. You can apply for those. One of the greatest feature of the meals program is, for example, if you're going to call the case manager and tell me, for example, Matthew, I don't like chicken as my source of protein. I would like to replace it. I would like to replace it with beef or salmon. That could be replaced. So every single component of your order could be replaced. So that leads to creating a new types of meals that would fit based on your needs and requirements. Um, and also, it works not like DoorDash or Uber Eats. So the way our delivery works, the driver goes to your place. They knock on your door, and oh, sorry, no, they give you a call 30 minutes in advance that in 30 minutes you will receive your meal. Please be present. If for some reason you're not present, a driver gives a call to the case manager. Then the case manager tries to call you again. If you're not responding, they give a call to the case manager, to the emergency contact. If the emergency contact for some reason is not aware of, like, why are you not picking up the food? And they give us the information back, we are allowed to call 911. So that would be like a final step. And because of that, there was a lot of cases where our Meals on Wheels program was actually saving a lot of lives. Recently, we had an example, our client who is a wheelchair user, they couldn't pick up the meal because they fell off the wheelchair. And because of our system of delivery, we actually saved a life. And yeah, that was pretty much about the meals. Um, I talked about the eligibility requirements. Um, no income, no insurance needed, and yeah, in order to enroll, I left the contact information. The phone number is 718-680-3530. Yep, that was pretty much. And if you have any questions, I will be more than welcome to answer.
There's one question. Janet, you have a question?
Yeah, the mention of 1 minute made me laugh. I'm sure you guys have the little bell still. My question is on the CB10 newsletter. I actually saw that you guys, the Meals on the Catholic Charities is adding a kind of you guys are visiting some of the seniors that need more just discussion and conversation, because when they're homebound, sometimes they kind of just want companionship. Is that something that you guys are still doing? Because when I call Catholic Charities, usually they don't know what I'm talking about. So I'm wondering if you could be a person of contact for that.
Yes, for me, if there is a referral who would be interested in, we call it friendly visiting. So if there would be a client who would be interested in the friendly visiting, we do provide services like that. So just to talk a little bit more, what is it? I'll give you an example. A lot of the seniors who our clients, they're all by themselves, and sometimes loneliness and boredom is way worse than any type of like known disease. So an example would be, I'll give you an example of our client. This is the real client who is enrolled in our program, who is a pretty active user, and they are one of the biggest chess players in the whole North America. Um, and they're very passionate about chess. And one of their requests for the services was for the case manager who is actually able to play chess with them. They weren't very interested. Initially, they weren't very interested in meals. They weren't very interested in the case management. They weren't very interested in the benefits. The only thing that was interested them was to play chess with someone and actually like pass some knowledge. Um, so yeah, the case manager was going there for a certain period of time just to play chess, and we actually gave a call recently to the client just to do a wellness check and see if everything's okay. And based on what they told us, they said that they're excited about the next match, and they're they're feeling pretty good, and they're safe and sound. But yeah, to answer your question, yes, we do that. And if you know someone who would be interested in that, just give us a call, and that would be part of the services that we're providing.
Thank you so much. And yeah, just a last question for the evening is, even for the committee as a whole, if we can kind of see as a resource to seniors, like a life alert that's not so expensive. I know that we have Bravo here. I don't know if that could help, like it be connected to a service, or we can get some connections going with local colleges and school partnerships. They're actually a lot more expensive than I ever realized. If you look into it, they need monthly fees or things like that. So if that's something that, this committee could look into, that would be so wonderful. And if
And
not, that's okay too.
and and another thing, as I implemented as an outreach coordinator, to every single place that I'm doing my outreach, I'm providing, I call it a concierge service. So if there will be a referral who would like to enroll into the program and they heard it from the places that I did outreach to, which includes the Community Board 10, if they mention it, they will receive an expedite service and they would put in a high priority list. So that makes the time that you need to wait to enroll into the program way shorter. And as of right now, I would say the intake flow is um, not very quick, because as of right now, like everyone is like going to vacations, like we entering into cold, and like people like getting sick, so the intake flow is not very quick. So if there is someone who would be interested, that would be a perfect time to do that, especially with the expedite time that I'm as an outreach coordinator are offering.
Thank you. All right, we have one more question. Marie.
Hi, everyone. Good evening. Okay, so you did mention like the intake flow, like how long does it take to get services?
The longest time that we processed one intake, the longest one during my whole time being as an outreach coordinator was a month. Not even a month, it was like 3 weeks.
So that's like with Meals on Wheels, having someone come visit their house. Okay,
Yes.
that's good.
Yes. And then also another thing that I forgot to mention, in order to enroll, you don't need to provide any sensitive information. The only information that we need to enroll and start the assessment is the basic demographic information, which is first and last name, date of birth, phone number, physical address, and the emergency contact number, and just a short description of the services that you would like to receive.
Another question I have, because I do know some of Catholic charities' budgets have lost funding. How does the senior, older adult programs look? Do they look like they're going to lose funding, or is everything okay?
Well, I represent two programs. I represent Benson Ridge, which is Community District 10 and 11, and I also represent the Queens Department, which is predominantly the Southwest Queens Department. And I can tell you that today I got 27 referrals who would be interested in the services, and they all being processed. So I can tell that both departments are on fire, and they all like trying to find the time to like serve everyone. So to answer your question, the programs are they're here, and they will be there as long as the services are needed.
Okay, well, thank you very much for the 3-minute presentation.
Thank you so much. It was my pleasure.
And for describing all.
You're
the
wonderful, such a young guy to us that
Thank
we
you.
are a little over 60. It
that-
seems encouraging
Something
because
else
the
is-
future
Yeah.
has a lot of
Okay,
hope.
I'm going to call the meeting to an end. Do we need a motion? Would someone like to make a motion?
Dr. O'Malley.
Okay, Dr. O'Malley, and a second.
Julie.
Thank you. Thank you for all of you out in Zoom land. Have a great
Zoom land.
evening. Great to see you all,
Great to see you.
especially the
Thank
people who let
Thank you
us.
so much.
Thank you, everyone.
Thank you.